COVID-19, we all know it's really contagious, really high transmission rate compared to other viral infections. Very important that we develop really robust local infection control pathways. There's lots of literature on that about suggestions, and it really does depend on your level of resourcing, as well as whether you're in a pandemic center or not. Your approach to how you use chest imaging, again, what resources you have available to you, what's your local infection rate, and then look at the patient. Do they need it for clinical reasons? Do you have access to a PCR result? If you do, that should help guide your management of that patient. The imaging findings, as we've seen, can be non-specific. Ultimately, you're looking at a viral pneumonia, and if you can correlate it with PCR testing, you should. In pediatrics, the literature is a bit scant, but they do tend to have less severe findings and they tend to have a less severe clinical course. But if the prevalence of infection does increase in your area, then you will start to find COVID-typical findings on imaging that you may perform for other reasons. And that may include the lung bases on a CT abdomen, or the lung apices, on a thoracic or a cervical spine image. So if you start to see those findings and you have a high local incidence, then you really need to correlate with your PCR test, and you need to have pretty close relationships with your clinical teams to talk about how appropriate the imaging is on a case-by-case basis. And don't forget that the usual imaging indications still apply. There are still lots of people out there having other medical problems that are coming in. If you might have a PE, you should check for PE. If you're worried about dissection, you should check for dissection.